When we're talking about heart pain, we usually mean chest pain around the heart. Fortunately, most commonly it is not caused by true heart pain. It's usually different causes. But first, we should exclude heart reasons. It's ischemic heart disease, and around 35% of cases it is caused by true heartache. It is called lack of blood flow to the heart due to the blockage. You can see here is atherosclerosis, and atherosclerosis can block heart flow and it can cause angina or heart attack. And what is symptom of ischemic heart disease? Symptoms usually is heavy, crushy or squeezing sensation, squeezing pain in the chest area, and this pain radiating to arms, jaws and neck and back. Shortness of breath also common, but shortness of breath usually occurs during physical activity. While person is rest, shortness of breath is less common. That's how we can differentiate it from anxiety. During anxiety, and anxiety also can cause chest pain, shortness of breath is common during rest. When person is resting, they still have shortness of breath. But in case of ischemic heart disease, there is lack of shortness of breath during resting. Sweating also common, nausea also common. Nausea and vomiting also is not common for anxiety. So during anxiety, shortness of breath occurs during rest, but in case of ischemic heart disease, shortness of breath is not common during rest. And this heavy crushing sensation is not common also during in case of anxiety. It's characteristic for ischemic heart disease, and radiation of this pain also important. Physical activity can be trigger. In case of anxiety, physical activity is not trigger of chest pain, and in case of ischemic heart disease, physical activity is trigger, stress is trigger, and relieved by rest or nitroglycerin. What is risk factor? Risk factors are smoking, hypertension, diabetes, high cholesterol. That's risk factor of ischemic heart disease. Second and most common cause of chest pain is gastroesophageal reflux disease. So gastroesophageal reflux disease occurs around 35% of chest pain cases. It's very common. And at this case, there is burning sensation behind the breastbone, behind the sternum. Burning sensation is important. If in case of heart disease there is pressure, squeezing, here is burning sensation, especially after eating, especially spicy foods and acidic foods. Sour taste in mouth and sensation of food regurgitation is also common. Chronic cough, hoarseness, worsening when lying down is important. When person lies down, this burning sensation increases. It's gastroesophageal reflux disease. What is risk factor? Risk factors are obesity, hiatal hernia, certain medications, and important is that this condition is very common among general population. That's why when person says that he has chest pain, we should suspect in many cases gastroesophageal reflux disease. Also, another common condition is musculoskeletal pain. So in young people, when person says that he has pain around his chest, and if he points his chest, it's in many cases it's musculoskeletal pain or costochondritis also known. This pain is sharp, localized, aggravated by movement or palpation. Person says that here is pain, and when he pain increases, it's musculoskeletal pain, it's not heart pain, especially in young people. Risk factors are repetitive strain, trauma, or unknown reason. In many cases, we can't define what is the reason. And anxiety is also important cause. In 10% of cases, anxiety is reason of heart pain or chest pain. This pain is sharp and stabbing pain with tightness, while in case of ischemic heart disease we have squeezing, we have pressure sensitivity. It's different from dull and pressure-like sensitivity and pressure-like pain from ischemic heart disease. Hyperventilation is common, trembling is common, palpitation during anxiety is common, and sense of impending doom is also important. Sweating and gastrointestinal discomfort, and usually it's also occur among young people. So if person is young and no obesity, no overweight, and says that he has chest pain or he or she has chest pain, usually it's anxiety or musculoskeletal pain. If person is overweight but generally healthy, it's usually gastroesophageal reflux disease. If person is after 45 and has history of smoking, sedentary lifestyle, hypertension, diabetes, high cholesterol, it can be ischemic heart disease. Thank you for your interest. Thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.